Now, sa blood pressure tayo. Sandali lang, ha?
Hindi lang, ma'am. Isesend mo yan, ma'am? Slides. Slides mo yan.
Now, nasa blood pressure na tayo. Sabi ko nga, the first sound and the last sound, these are the blood pressure of your patient. Now, the arterial blood pressure is a measure of a blood pressure exerted by the blood as it flows through the arteries. Now, there are two blood pressure measurements. Ito yung systolic pressure. Yung systolic pressure is the maximum pressure developed on the ejection of blood from the left ventricle to arteries. So, ito yung first sound that you will able to ito yung ito yung first sound. Diastolic pressure is the lowest pressure and is the means of peripheral resistance. So, ito yung natin, di ba? What is the diastolic of the patient? Systolic of the patient. Ganon. So, usually, pagka, the normal blood pressure is 80 over 120. Pero, it depends yan sa age din ng patient natin. In measuring blood pressure, it means also you have to auscultate the patient. You have to check for the systolic pressure. You have to check by your two finger also para mo siya kung saan ilalagay yung stethoscope. Usually, it's taken to the point where it beats and becomes audible. You have to put the stethoscope where it's audible. The mercury continue to fall from the sound to the beat become louder and gradually diminish until the point it is reached in which this is sudden marked diminution in intensity. The average blood pressure is 120 for 20 years old, and the average of at the age of 60 is 160 over 90. Because the blood pressure, it depends upon the ages also, or depende rin sa condition ng patient natin. Now, this is an Android manometer with stethoscope. Ito yung mga instrument that we are have to use in taking the blood pressure for the patient. Now, there are parts of the sphygmomanometer. Then the black part is the cuff, and then the other one, yung the one that we are putting in our ear is the stethoscope, and the tube, which is the tube to sphygmomanometer. Also, we have the bladder, the bulb, and the valve and the bulb. Ayan siya, yung part ng stethoscope. You know, this is the manual stethoscope that is, you know, I really consider na mas maganda yung manual than the one which is digital, because, you know, when you know it's the manual, it is very easy to get the digital. Now, when you are taking the blood pressure, this is measured with the blood pressure cuff with sphygmomanometer and stethoscope. The blood pressure cuff is a bladder that can be inflated with air, and it covered with a cloth and has two tubes attached on it, and it's sometimes three. One tube is connected to the rubber valve. Now, you have to introduce the air, turn the valve clockwise, and release the air into a counterclockwise. And the second tube used the sphygmomanometer on the third stethoscope. Ito yung example how to take the blood pressure already. Now, in auscultatory method of obtaining the blood pressure, first, the healthcare provider, the caregiver, the nursing aide, the nurse, or any healthcare caregiver that doing the blood pressure must provide to determine the Korotov sound. This is the series of sound that we heard in blood pressure assessment. The first phase is the Korotov sound. The first faint clear tapping and zoom. First beat na we heard from the stethoscope. That is the first that we heard. The sound that is gradually become strong and deep. Ayun yung first phase. The second phase is that the period of deflation where the sound wave increasing quality. Yung nag-ano na siya, nagdi-diminish na siya. Oo. And phase 3, the period which the sound forcefully, ito pala, mali pa pala. Ito yung nag-ano na sa increasing quality, and the the third phase is the period which the sound is forceful and powerful. And the phase 4 is the time when the sound begins with decreased intensity. It has a less bounding force. And phase 5 is the pressure level within the sound is stable. Pag nawala na siya. And reading the blood pressure, the first sound can be here. Can be here is the systolic pressure, and the last sound can be here is the diastolic pressure. Pwede nyo, you have practice doing now. If you have the instrument now for blood pressure, you have to practice it now with your colleague or with your flatmate or any relatives that you have sa bahay ninyo, so that in the near future or before we have to meet also, you will be able to do it now. And this is the first thing that since we are nursing aid, we usually do this one, the vital signs. We are the tasked to do the vital signs. Now, this is the mercury manometer and the cuff. Ito yung the first na during our time, this is the available one. And this is the high-tech before that we have. But now we have so many types of instrument for taking the blood pressure. The only thing that we consider is that the mercury manometer and the aneroid manometer and the cuff. Ito yung usually we are using it in the hospital. Yung mga pictures, the one that I show you is that ito yung dalawang types ng sphygmomanometer. The first one is aneroid and mercury manometer, and the other one is aneroid. It is calibrated deal with needle that points the calibration, while to the other is calibrated cylinder. Ito siya. Ito yung dalawang types of sphygmomanometer. There were the other types also that is available now in the market is the electric sphygmomanometer and the Doppler stethoscope. But the most common one, the one that I show you. Now, ang variation ng BP cuff. If the bladder is too narrow, pagka, kunwari, if you take the blood pressure, because the cuff of blood pressure may depend also if the patient is obese, if it's the patient is teen, or the patient is children, or it depends the ages or sa features
size.
The size ng patient natin. So, ang pag-ano natin dito, if the bladder is too narrow, to obtain blood pressure reading is error siya and elevated. It is too wide. The reading is erroneously low. So, dapat tama lang yung gagamitin nating cuff. The width should be 40% to the circumference or 20% wide than the diameter of the midpoint of them in which is used. Kadalasan kasi, right now, we have improvised in the hospital yung mga we have the big size and middle and the small size. Pero if you are working in the at home, I think they will provide you which is fit for the patient because the blood pressure that they are giving to you, it's personalized for one patient. So, para sa kanya lang yung blood pressure na gagamitin. So, there will be no problem for that one. It's only for the hospital that we have different types of blood pressure for the cough because it depends if they are thin or obese sila. And the length of the bladder should be sufficiently long, almost encircle the limb to cover at least 2/3 of the circumference. Dapat mahaba siya. Kasi if it's very short, when pag in-squeeze mo na yung speed manometer, tapos habang you are working with your blood pressure, suddenly nagpa-pop up siya. So dapat long yung long yung bladder niya. Kasi kung hindi siya long, madali siyang bigla nang mapapop up. You will not able to take the blood pressure of the patient. So, the cuff must be fitted for the patient. Ito yung variation ng blood pressure by age of the patient. Usually, newborn, we are getting the blood pressure of 73/55. And then for 1 year, it is 90/55. Yun ang minimum ng normal ng 1 year old. 6 years old, 95/57. For 10 years old, it's 102/62. For 14 years old, we have 120/80. And for adult, we have 120/80. For elderly, which is over 60, diastolic may increase. And sometimes also it depends upon the condition of the patient. If we have a patient with a condition, meron siyang sakit na prevailing illness, iba na rin yung normal sa kanya. Which is sometimes it's 130, ganon, over 90, it depends, it vary also. For as long as na yung yung over niya, hindi naging 100 plus, parehong 100 plus, your patient is safe. At ayun lang po. May pala ako, idadagdag regarding the body temperature. Yung body temperature pala natin, which is the core temperature, yung temperature, yung pinaka-deep tissue ng body natin as the abdominal cavity, pelvic cavity, is relatively constant. Ito yung core temperature. Kung mas kinuhanan mo ng temperature niya, ito yung red part na yun yung involved ng But for the body temperature, which is the surface temperature, ito yung ang skin natin, which is the subcutaneous tissue, the fat. It is by contrast, it rise and fall in the response of the environment. Ito tumataas o bumababa, depende sa environment. For temperature natin, it depends how our body will react inside us, inside the abdominal cavity, pelvic cavity, and all of our body. Ito, it depends how also the environment respond. Now, may gusto lang akong i-discuss. Kasi gusto kong nahulit kasi tayo, we are late for the others topics. So I want you to have this one. One minute, ha? It's different. 1 minute. You could take a break, mag-coffee kayo muna sandali. It's regarding the patient safety and quality. Um, Now, I just want to inform you, there are some topics already that we improving the patient safety. In healthcare, it's often compared with the other complex adaptive system, such as the katulad ng airline and nuclear industries. But there are striking differences for airline. For example, pilots don't just get up and lift in the in the mid-flight. Tinatapos nila yon. But for a healthcare industry, patient often has different providers, nurses throughout the care and experiences. So we have to 1 minute ha, parang hindi ko nakuha yung ibang ano. Okay, this one. Now, for the safety that we have as a care, we have to consider for the culture and analytics, the evidence based on the practices and adaptations. So, improving the outcomes and lowering the cost through the culture and clinical analytics evidence. Uh, 20% of healthcare professional, they would not speak about the witness issue. Some problems that we are not, hindi tayo nagsasalita if we say something. But in arthroscopic wrong side, surgery reviews, about 60 to 80% of people interviewed, they said that they knew the incision was being made wrong in the first place, but some healthcare do not speak. So we have to improve our patient safety. Now we have to very careful to take care for our patients. I think this one is not already. We have to very careful with our patient. We have to render the best quality of care that we have known. We should, if the patient is talking to us, or we have to be flexible at all times. We have to talk with them nicely, politely, and we have to consider how they feel, so that the patient, we could get the rapport, or the rapport that we have, so that we could able to perform the care that we have to give to the patient. So, in taking care of the patient, we must not, we will never leave the patient alone. We have to take care for them. We have to watch them carefully, and we have to assist them what they need, and we have to take care for their confidentiality also. There are some information for the patient that they need to keep for themselves, so we have to shut up our mouth and keep it confidential, because this is the ethical issue of some patients that are very critical. They don't want to be talked about, how they, how the situation, or their family, or about everything about them. So we have to be very careful for that one. And also, when the patient is sick, we have to give the full attention for them. And when you help other people, when you help especially those who are sick, it is also a pride for us if the patient is getting yung nakaka-recover siya, ganon. So we come to see it that our patient will be recover and easily. So we should not only thinking yung kung magkano yung ano natin, kikitain natin, but we have also the very careful na yung mga gamit nila, yung mga things nila na dapat din tayong tumulong sa kanilang mga expenses, katulad ng mag-save tayo, yung mga paggamit ng mga tissues nila, yung anything na they need for their daily grooming or anything. So you parang naging part ka na rin sa kanila. So there is also what we call the patient satisfaction, kasi we give the best care that we have, and naluluwa yung cost natin kasi yung mga expenses nila, natutulungan mo rin sila. And if we have render the best care, na ibigay natin yung pinaka-best care sa kanila, patient are happy for us. And yung better care na naibigay natin is really hindi lang yung sa skills mo, kundi compassionate ka. It's also a pride for us. Kasi yung pangalan nito, hinakatulong ka na hindi lang tayo ng na kikita tayo, kundi mag-work tayo because we are skilled and we are knowledgeable. Hindi ko lang maanuhan yung ibang dito eh. Pero gusto ko rin na rin yung ibang studies na hindi natin na-tackle. Like for example, itong patient safety goal. Now, ang main object natin dito for the patient goal is that to promote the specific improvements for patient safety. We have to represent the proactive strategies to reduce the risk of medical error. Dapat ma-reduce natin yung mga error sa patient natin. We have to provide clear priorities and solution for providing patient safety. Hindi tayo yung dapat when we go with the patient, we are ready for it. Now, for internationally patient safety goals is that we have the number one, especially when you are in the hospital, as a caregiver, we have so many patients already in the hospital, and hindi lang isang pasyente mo. So we have to identify the patient correctly. We have to check for the patient if it is the right patient. We have to improve the effective communication. We have to deliver the right communication for the patient, right channel also. Because if we deliver the right communication, magiging smooth yung smooth yung providing care natin sa kanila, and there will be no doubts or any mess, hindi magkakagulo. Patient will be able to talk with you, and she will like you because you are communicating with each other. There will be a two channel. The patient will talk and you will listen, and then when you listen that one, you can render also, you could yung passage pa ng means of communication ba, it's very clear. have to improve the safety, high alert medication. So if there's any medication or any procedure, you have to be aware for that one. Like for example, somebody asks you to go and check the patient. Can you please check the patient if there's any yung because in some in hospital there is a like leakage or like ang pangalan nito parang marking ba parang yung arrow kung saan ka gagawin ganon. If the patient, you will give the medicine for the patient, right, it's green, or if it's wrong, it's there is a red. You could not be able to give for the patient like that. Or if the patient is any information from him, from the patient, like for example, you want to do uh, you wanted to get blood pressure on her brachial area, and the patient doesn't want, and then he that, and on her choice he want to do it in the other part area. So he instructed all the nurses already, or all the caregivers or all the nursing aid not to take the patient or on that side. So there is a what do you call this one, like note to also to ensure the correct site or correct procedure, correct patient in surgery. You have to check for the identification, and be sure that you have to check for the files also for the natanggal. You check for the orders. Usually, this one is the nurses delegating us what to do, or you have to bring the patient to OR like that. So you have to check for the right patient. You have to communicate with the right patient. You have to check if there is any alert sign for medication or any instruction like that, and you have to ensure the correct site, correct procedure for the patient, where to bring the patient like that. To reduce the risk of healthcare also, like for us associated for infection, we have to do always do the hand washing or hygiene for us to reduce the risk of the patient, which is harmful, resulting from falls. Also, we have to put something like for example yung pangharang sa kama niya, or you have to
Side rails.
side rails. So you have to watch for the patient carefully, and hindi natin yung iiwanan na basta-basta yung patient natin. If we bring the patient in one area, we have to be with them. We do not leave the patient alone. And if the patient is sleeping, always put the side rails, because if you don't put the side rails, especially when they are moving, they are sick, it will be a great problem. Now, to identify the patient correctly, you have to ask two identification, which is you have to ask the full name and the medical record. This is very important because especially here in UAE, there were so many patients with the same name, and only in one name, yun lang ang difference nila. So you have to ask for the full name of the patient. And if you are not satisfied, you ask for the identification card for the patient. And you check for the record number. And you have to verify the patient identification before you do the procedure, or before you bring the patient to X-ray, or before you bring the patient to OR. You have to check for the flight identification. You check for the wristband. If he is really the patient, baka naman nakuha mo sa kabila kasi sharing sila, iba yung nakuha mo. So you have to check for the wristband of the patient. And time out before starting the surgical or invasive procedure. You have to preventing the wrong site, wrong procedure, and wrong patient surgery. You have to check for that one also. Uh, um, Not to use for identification patient room numbers, location. It is better to check or be with you the record number or medical record number and the full name of the patient. And number two is that to improve effective communication. The hospital develop and implement the process to improve the effective verbal and telephone communication among the caregivers. So every one of us is entitled to communicate in a nice way, in a right way, and do not assume for all things. Kunwari, may mga bagay na we have to do, and then you assume. In healthcare, we are not doing assume. Do not assume. We have to communicate. We have to confirm if it's true. And sometimes even in the documentation for the file of the patient, if it's either when we are in doubt, we have to confirm with the verbal or in telephone communication. And hospital also develop and implements process of reporting critical result in diagnostic tests. So if there in case result for a critical result of the patient, you have to keep it in mind, keep it in secret, and all things is confidential. Do not talk things with your patient, especially pag andun kayo hospital, because that is you're invading the privacy of the patient, and doing that there's a chance na you will remove from work also. The hospital develop implements a process of handover communication. Yes, this is very important. If you are going to off from duty already, you have to wait for someone, or you need to endorse the things that you have done to the next duty, so that the continuity of care is dire-derecho, and there will be no discontinuity, because this is very important. Sometimes you do things and it is not yet an order, and so the next shift um, it was recorded that this thing is supposed to be give, and you did not endorse it, and the next duty implement it, so the patient having this double what they call this one, like for example, you give medication and the other thing you did medication, that's so it's become overdose already, or doing like for example blood pressure, and you make it advanced already, it's not nice that one. So it's better to do the handover with your colleague. You have to wait for them for the better communication for your patient. Now, ineffective communication, usually yung reporting critical test report, yung also it's very important. If something emergency, there is a report for the patient, you have to send it immediately. And if you are not able to endorse with the next duty, it will be a big problem, because it's time for them to carry out the procedure. Reporting critical test result, like potassium result was reported in the laboratory by the nurse, and the nurse hears as very low, like for example 2.7. After the patient laboratory result, it's entered to the screen, and you do also an error, and that's the thing, and they will not give the proper the you put in the error is 8.7 the result, but it's the result is 2.7, and the continuity of care, they don't care about it already because it's normal. The nurse, he told it's normal, so she did not do anything. So that's also for the nursing aid. If you were instructed to do some, like for example enema, you do enema, and because the patient will go for surgery already. You have to clean the stomach or the lower part of the patient. And then you write this one, it's for tomorrow. But then, but the order is today. So you have to, the order is today, and they will do it already, the surgery. And what happened is you did not do it. So there will be a problem. There will be delay of the operation because of the this miscommunication or ineffective communication. There must be a clear communication between the health team. Now, improve effective communication. This must be accurate, complete, um, unambiguous, and understood by the recipient, because it reduces the error and result will be improved for the patient safety. Um, you have to report the critical test result immediately. And verbal and telephone orders should be included to be write down, and it must be read immediately also. The standard of communication method includes the asking and answering the question during the hands-off. Yeah, it is better to ask